One of the questions I get asked frequently when I'm working with young dancers is, when is it okay to start dancing on pointe? Dancing on pointe is kind of a rite of passage among young dancers, and they really tend to look forward to it with really great anticipation, but the same thing makes their parents terrified that their daughters are going to end up with some kind of crazy foot injury. Part of my role as a therapist here at Nebraska Orthopaedic is working with young dancers as well as professional dancers in the community. I'm actually the official physical therapist for Ballet Nebraska. I have been dancing for about 20 years, so I have a background in dance, and putting that together with my passion for physical therapy and my physical therapy knowledge, it tends to work well in helping dancers get back to what they love. I wish I had a great, easy, straightforward answer as to when it was okay to start dancing on pointe, but because every dancer's development is a little bit different, there's no great textbook answer. Traditionally, the answer was they can start dancing on pointe at 12 years old, but every dancer's development is different based on timing, onset of puberty. And pointe work does put a lot of stress on the body. There's definitely a risk for injury, and starting too early can put too much stress on not only the foot, but other parts of the body as well. In addition, growth plates of the foot and ankle are still open until about age 14 or 16. So there's some concern that dancing with these open growth plates could cause permanent damage to the ankle. Luckily, we have no medical evidence that dancing on pointe with open growth plates cause any damage. So that's not a great indicator as to when dancing on pointe should start either. Based on some recent literature from the International Association of Dance Medicine and Science, the best predictor of when it's okay to start dancing on pointe is not age and it's not growth plate closure, it's really their dance technique. Obviously, you have to dance well in flat shoes before dancing on pointe is a good idea. Along with strong technique, a dancer really should show a true commitment to the art form. They should be dancing at least twice a week and have at least 3 years of previous dance training before they start dancing on pointe. However, there are a few things that I can look at that give me some insight into whether a dancer is really ready to start dancing on pointe or not. First, I look at alignment. The dancer needs to be able to do not only dance-specific movements, but other non-dance movements with really good biomechanics that aren't putting too much stress on other parts of the body. Second, I look at ankle range of motion and strength. Ballet, and especially pointe work, requires some really extraordinary ankle range of motion, strength, and control issues. So I want to make sure that the dancer's ready in that term. Third, I look at hip and core strength. Those muscles are actually really important when dancing on pointe. They help pull the dancer up out of the shoes, which can help minimize the risk for injury. So I check that out too. If any of those three things are lacking, it doesn't mean that the dancer should never dance on pointe. It just means we need to do a little bit of work before they're developmentally ready. So I bring them into the clinic, I do a little quick screening, and I'll recommend some basic strengthening or stretching based on exactly what that dancer needs. If you as a dancer or a dance mom who is concerned about your dancer starting on pointe, come in and see me at Nebraska Orthopaedic Hospital. I'll do a pre-pointe screening looking at those three big things and give you some confidence when it comes to starting dancing on pointe.